What's up, Candy Ken? What's up, Baby J? How's it going?
Not today.
Candy Ken and Baby J.
It's Candy Ken.
Welcome to the Candy Ken Show.
I'm fascinated because OnlyFans made this possible, this podcast.
Really?
Because I didn't want to make it at home. I was thinking about doing a podcast for years and years and years, but you need money for a podcast. Because
you do.
Yeah, because the setup, you need another person working for you. You need 3 cameras. It's not like a TikTok that I can shoot on my phone like easy, you know?
That's true. Yeah, it's a lot more involved.
Yeah.
You obviously need someone to do editing. It's a little more involved. Camera lighting, your space is very important. Mechanics of the space is very important. And like you're saying, you're shooting on social media, you're shooting TikToks or Instagram Reels or whatever it is. You're basically just getting clips of things, and you could do a lot with editing just off your phone. When you do a higher quality podcast, you'll notice a lot of people's content that's for social media isn't as good because usually it's the audio that's lacking, not the video.
Yeah.
And a lot of microphones and things like that, they're just not that great.
Exactly. So with OnlyFans, there's so much money involved that there's just like you can work on a much higher end quality. And which brings me to you because you also work with a lot of OnlyFans girls.
I do have a lot of patients who are on OnlyFans, or they're OnlyFans girls, or they're involved in the production. It's just so common. You know, it's almost like saying I have an employee, or I work on someone who's like at Target, because now it's like there's so many Targets, there's so many employees. It's kind of like the same thing. Anybody can do it. It's like almost as ubiquitous as Uber.
Yeah, it has really changed. It's more common to fix your body. Tell me what you do.
So I'm a board certified plastic surgeon. By the way, should I look over this one?
Mm-hmm. You can look at this one.
You're gonna edit all this out, right?
It's a live switchboard, but
okay. Are we live right now?
Uh-huh.
Oh shit. Okay.
Yeah, that's your camera right there.
Oh, that's my camera. Okay,
Yeah.
Perfect. All right, everyone. Yeah, ignore the fact that I was messing up. So your question was, what do a lot of people get their bodies done? It's a lot more common.
It's a lot more common, and tell me what you do.
Yeah, so I'm a board certified plastic surgeon, a Stanford graduate, and I have my own practice in Calabasas and Beverly Hills. The name of my practice is Modern Plastic Surgery. I run the practice. I'm the sole MD, founder, and run the practice. I do surgery, sometimes even 6 days a week, but usually Monday through Saturday. And I do everything head to toe, plastic and reconstructive surgery. That includes faces, noses, breasts, tummies, lipo, BBL, you name it, reconstruction, cancer reconstruction, burns, everything under the sun, really, even hand surgery. So, of course, we're in LA and I'm in Calabasas and Beverly Hills. So a lot of what comes through my office, as you know very well, Candy, is a lot of aesthetic or cosmetic surgery. And I definitely do a fair bit of liposuction as part of my practice, but also a lot of breast surgery, BBLs, and a good amount of noses and faces as well. So,
and lips.
A lot of lips as well, as you and Baby J know. Yes, yeah. I do a fair amount of lips too. I do have some nurses that do injections for me, and so I typically will do the injections for patients who have been with me long enough, like Baby J or anybody who's kind of been with me when I first started a few years ago. But as I've grown surgically and my volume has grown, I really have transitioned that aside more to the nurses in my practice, and just kind of by request, I'll do injections for patients.
Man, so whatever you need, this is your guy. He takes so much pride, and you're very like a perfectionist when it comes down.
Yeah,
which is really important, I think, especially when you go under the knife.
I appreciate that. Yeah, I remember you told me that the first day you met me, you're like, dude, I've never seen someone pay so much attention.
Yeah.
Because obviously, you've been there in the past when she's gotten injections or got other work done in the past. But I take a lot of pride in my work, and, I'm a perfectionist almost to a fault. But I really enjoy what I do. And so, I just like to have fun at work, and, long days, sometimes 12+ hour days, but it's always worth it. I never feel like out of breath or out of energy at the end of the day.
Yeah, it's a really different experience, because normally I think the average is that like 7 minutes that you get with a doctor in America.
That's
so
correct.
when we sat down with you, it was like more like meeting a friend or hanging out with a friend more than like this doctor patient experience, you know?
Yeah, I appreciate that. A lot of my patients tell me that they feel like they've known me from before, or, they really appreciate how much time I spend. And I think that's really important because, at the end of the day, it's not like it's 7-Eleven. You don't want like just a ton of volume of patients. I know some plastic surgeons or cosmetic practices have that model. I don't really speak to that model. I have more of a boutique practice. And I'd like to provide a high level of service to the patients that come through. So thank you. I appreciate you.
Man, and then so you have a lot of OnlyFans girls.
A lot of OnlyFans girls come through the office. Yep. Some of them are open about the work, some of them are not. So that's always very interesting. Some of them want to shoot some of the content that they're having of what they're having done for their page, which is always interesting being in someone's content or when they shoot something at your office because you never know where it's going to end up. So
Yeah, and then some keep it super secret that they got work done.
yeah,
I guess, right?
yeah. Some people will approach me and say, hey, I can only do this on this timeline, or I only have like this week or these 2 weeks because can I get my surgery done and be healed in time to be able to, basically go back to shooting. And it's always very sensitive because it depends on what they're doing. I have to provide some restrictions. So, recently had that with another kind of adult film star also that came in my office, was having some work done on her face. And she said, hey, I'm going to be doing XYZ in 2 weeks. And we had to kind of pull back a little bit on what we were doing because I said, there's no way you're going to be ready if you're going to be doing all that on set. And so we altered her plan, but it all worked out great. So it always works out.
And also, it's almost like an investment, I guess, especially when you use your body for your work to make it look even better.
Yeah, I mean, I think that's why a lot of these girls do come in to get work done. So everyone has their reasons. Some people have had kids and they just want to get rid of like their kind of that lower hang of their belly and they just can't, no matter how much they worked out. Some people have stubborn fat. Some people were always self-conscious about their breasts and they couldn't afford it before, but their work now affords that to them. So there's a variety of reasons, and one of the important things is you always want to talk to patients about like, are they making choices for themselves? You never want to do anything for anyone that they're being pushed into, or their friends or their coworkers or their managers, for example, for some of the OnlyFans people, that they're being pushed into getting work. You never want that. You want them to get something that they're going to be happy with because ultimately it's their body. They should want to have it done and they should be comfortable with that.
Yeah. Do you ever turn down patients where you're like, you're not ready?
I have turned down people, which is always a hard thing to do. And it's a rare thing, thankfully. But yeah, I have had patients where, they weren't following their pre-op instructions or they were coming in for surgery and, we'd rescheduled maybe once or twice already. And they're still not quite on the same page. And I say, you know what, I think maybe this is not a good match. You're not quite where you need to be, or you're not quite getting it. And I don't want to do surgery on you just to have you. I don't want to set you up for. I want to set you up for success. I don't want to set you up for failure. And so we'll cancel surgery and we'll reschedule for way down the road, or we'll just cancel altogether. I could probably count on one hand how many times that's happened, but it does happen. It's always a really awkward and interesting conversation, but it's always for the best of the patient. So,
is there sometimes it's such a huge life change, right? When you meet the patient at first, I guess, and then like you take so much weight off them. Is there like sometimes a conflict where you like still you have this fat behavior in your head, but then you lost the weight, so they don't fall back into like old patterns and like that they need this to get like fat away from their body all the time?
yeah, one thing that's really important, and that's a great point, is that, people, I always tell them when you have surgery done on your body or your face or anything, it's not just the actual procedure itself. There is a component of a behavioral change. And that's really important as well, because a lot of times what I notice is people, once they have their surgery, will be more motivated to work out or more motivated to basically keep the weight off or whatever it is because they're so happy with how things look. Now they kind of see what they've achieved, whereas sometimes maybe people didn't have the motivation to actually have something done. But once they've had it done, they're like, oh, you know what? I'm not going to let it slip. I just, I spent I spent a fair bit of money on my body. I'm not going to let it slip because then I'm going to have it again, or maybe I'm not going to be a good candidate for the revision surgery. And so I don't want to do that. I really like how things are looking. So I'm going to stay motivated. I'm going to go to the gym. I'm going to do all those things. So there is that aspect. You do have occasionally where people say like, I didn't really keep up with it. Can I get a little touch up here and there? Sure, you can always do that. But yeah, it is an important thing. And I always make sure patients are not just, obviously physically ready and healthy, but also mentally they understand they're going to go through a change, and it's always for the positive. So we want to always be on the same page.
And is there some sort of addiction too that once you get started, you want more and more done?
People say that. It's kind of an interesting question.
Like a cliche, right?
It's a cliche, like, oh, you don't want to get addicted to it. It's not. I think addiction is probably not the same word, but I think it's more like it does kind of unlock a little bit of like, hey, I enjoy this, or a lot of people haven't really taken care of themselves. If you come into my new office, which I think you guys haven't been to yet, just got built out, it's brand new. I have a big pink neon sign on the back of the wall that says, I love me, because that's really the motto of the office. It's about self-care. That's why people are coming in. So I think it's more that people get excited about self-care, where they get something done. Maybe it's an injection, maybe it's a surgery, maybe it's whatever. But they're like, oh, it's nice to finally do something for myself for a change. Whereas maybe they've been doing it for their family or friends or work or whatever it is. So I think where that's a lot of that comes from.
And then when you get ready to cut them open, does that, like, what's your routine, or like does that make you nervous, or have you done so many that it's like a routine? Or
one thing about me, if you've gotten to know me over the last few years, I'm pretty calm and I never get nervous when it comes to surgery.
Yeah.
And I think a lot of that has to do with the fact, though, that I always prepare for every case, no matter how big or small, before I actually do it. So before I actually do surgery, like, I'm not talking that morning, I'm talking like a week in advance, I'll review the photos. Days before, I'll review kind of what my notes had said, what the patient's desires was, what everything was. Sometimes I'll print out the photos and I'll actually mark on them before the surgery, what's my plan. So I've actually gone through the operation a few times in my head before I ever actually put the scalpel to the patient. And I think that's actually a big part of the key to my success, and why patients have been very happy, thankfully, with their results, is because of that, because I prep a lot mentally and I've already thought it through. There are a lot of people that show up and they just kind of do the surgery out of routine, or people who have been maybe doing this for decades where, they're like, oh, it's just another breast implant case or breast augmentation or whatever, another lipo. But in reality, every case has a little bit of its own flavor. And so, I don't know, at least for me, I personally like to spend a lot of time kind of thinking and preparing. I might be out to dinner with family and I'll just kind of be thinking about the next day's cases and, oh, I should probably start on this and this. Or I'm doing a mommy makeover and there's a bunch of different parts of the case, like breast, tummy, lipo, BBL. I'll say, you know what? I think I'm going to stage it where I'm going to do this first. Then we'll turn the patient around, do this part and this part. And that's always, again, kind of planning it out. So when you get there, there's no like middle of surgery. There's no wasted time. Everything's like a symphony, There's unspoken just excellence. Like the conductor's just moving their fingers and their hands and everything's moving the way it should be. That's how surgery should be.
And how do you practice for surgery?
All the years at Stanford that I did and all that was plenty of, experience. And
what do you cut open before the first patient? Or
oh no, I don't practice, but I'm more mentally preparing. No, I do a high volume of surgery, and so I'm very comfortable surgically. But it's more about just making sure that mentally you have all your steps, things like that. And so, for example, like doing a rhinoplasty, every patient's a little different. Someone has a bump, someone doesn't, someone wants their tip up, someone doesn't. Maybe it's a revision. So there's all of these little details. And sometimes I'll even put my operative plan on the wall. So even my team knows what I'm thinking, even when I'm kind of silently working and doing the thing on the nose, or maybe I'm reshaping the tip with sutures or whatever, bring the tip up or whatever it is. That way they'll see it and they'll know exactly what I'm going to be doing, even if I don't have to say anything.
But when you first get into the business, do you like assist a doctor, or like when you first like cut somebody open?
Yeah, no, that's a good question actually. So
because nobody wants to be like the first, your first patient.
So going back to when you're in medical school, when you're in medical school,
like I don't know how it works. Yeah.
So when you're in medical school, that's kind of like you're learning about medicine, you're learning about human anatomy, physiology, all those things, and you're doing rotations in the hospital.
Mm-hmm.
And you're working with what's called an attending surgeon, who's like the main surgeon who's been practicing. There's a resident who's a trainee under
Mm-hmm.
that surgeon, and then there's you who's a medical student. And that's kind of like your first exposure to actually be scrubbed into surgery and touching patients that are actually undergoing surgery. And then from there, you get a little bit of experience. They might let you make an incision with a scalpel and do those types of things. And usually you're not doing that on cosmetic surgery patients because it's more delicate work starting out. It might be like you're doing an appendectomy and taking care of someone's appendicitis, or someone has a hernia, or something like that. Then you go on to when you pick your specialty and you're in residency, right? So then you're the basically trainee surgeon, but you're doing procedures and you're starting on a more minor level, doing smaller procedures. And then under supervision, you're kind of graduated up to higher level procedures, which, typically cosmetic surgery is considered one of the higher level procedures, aesthetic surgery, because again, it's more delicate work. And it's also work on people who are not necessarily, for somebody who's like really sick and has like some kind of infection or something like that you're trying to treat. That's, obviously it's more urgent emergent versus this is like people are generally well coming in and they're having surgery done. So you need to make sure they leave well also. So it's a little bit of a different standard. So all of those years was basically what kind of went into being able to do this. Now, when I left residency years ago, and now I've been practicing, for several years, now that basically there's no more prep that needs to go in. All those years, the more than 10 years before that was the prep. And so now I'm practicing. So that's kind of how it works for any surgeon or doctor. In med school, you get your first exposure, then residency, you're kind of like in training doing surgery, but under supervision. And then you're actually in practice. And so that's what I've been doing the last few years.
When did you make your decision that you want to go into like the beauty or in plastic surgery?
I made the decision my third year of med school. It was actually kind of by chance. I liked every specialty when I was going through it. I was doing internal medicine, I was doing surgery, all those things. And one day I was, by chance, they said, hey, the director of plastic surgery, I went to med school at UC San Diego. They said, director of plastic surgery at that time needs an assistant. And I was with a different surgeon for the day. And they asked me, hey, do you want to join her? Because we don't have much going on today on our side. And I said, yeah, sure. So that was kind of like my first exposure. And I thought it was really cool that we were doing kind of head to toe plastic surgery, because plastic surgery is one of the very few surgical specialties that actually does head to toe surgery. So all the way from the top of the scalp to the bottom of the feet, whether it's aesthetic surgery, whether it's reconstructive surgery, cancer reconstruction, head to toe, we do everything. And so we were there from like 7:30 in the morning to like 11:30 at night. But it was so great. That was kind of like my first introduction. And at the end of the day, I remember the surgeon, she was the head of the whole department. She said, you have really good hands. You should consider doing plastic surgery. And, with like a lot of things, if you have good mentorship or guidance, it helped. And so I did a 1-month kind of elective in plastic surgery, got more experience with it. And I kind of fell in love with the field. And I still love what I do. That's why I'm able to work so much, because if you don't love what you do, I'm sure you won't be able to last working that long. But that was kind of like my introduction. I said, okay, I'm going to do plastic surgery. That's going to be my profession. That's what I'm going to do. And then, here I am more than 10 years later.
What's your favorite? Is the favorite the results or the pumping the fat out?
No, I don't.
Or
I get this question all the time. It's so hard because
the whole process?
yeah, I think it's it depends. People say like, what's your favorite procedure? What's your favorite part about your job and all those things? I think when I see people, and whether it's like something small that they get done or something big, it doesn't really matter. But I think when I see people really excited about themselves and they have like a regained self-confidence, or they have this, you can see their transformation. I think that's like super exciting. And that's like really invigorating to basically just keep going. When I get messages or I get cards and thank you cards, or, just the gratitude of patients really just kind of keeps you going like over and over, because, as you were saying, I'm a perfectionist and I really do pour my heart and soul into things. And you'll never hear me say in the operating room, like, oh, that's good enough. Like, it's never good enough. I'll always just kind of keep perfecting until it's to the patient's expectation, as much as realistically as possible. And so it's really nice. I've gotten some of the nicest cards and gifts, and I keep all of them. I have a kind of an area in my office that I keep everything from all my patients. I've got some really cool stuff from people. I remember patients said, like, I saw them a week after surgery and they're like, oh, I was like, oh, I really worked my shoulder out when I was doing your surgery. So she was kind enough. She sent me a mobile masseuse to my office and surprised me with an hour massage, and like she told my staff not to tell me. And so it's just small, it doesn't have to be anything big, but just the excitement and the gratitude, it really keeps you going. That's probably my favorite part. And it doesn't matter what it is. Probably one of my favorite experiences in plastic surgery was a little bit before COVID kind of hit the world. I was in Guatemala doing pro bono surgery for kids with cleft lips and palates and things like that.
Oh yeah, you told me about that.
Did I tell you about this?
Yeah.
So, the world probably doesn't know this story, but I was there for about 2 weeks. I only got 3 weeks vacation for the whole year, and I donated 2 of my 3 weeks vacation to go there and do surgery. And it was such a crazy experience to see all these mothers that had walked for days just to bring their kids there because I was coming in and I was going to be doing surgery. And it really just goes to show you, like, it was better than any object or
Maybe explain what surgery you did.
yeah,
there.
so I was doing like kids that had a cleft lip, so like a tear, an opening in their lip. It was congenital. They were born with it, so the lip was just split apart. Or the palate, the roof of the mouth, where it's open and there's a communication between the nose and the mouth. For example, some of those surgeries. Some of the older patients that I also treated while I was there, they just kind of walked in and we didn't know. Like somebody had injured their hand, and they had cut their finger halfway open and they're basically putting it back together. Or an older gentleman that came in with a bunch of skin cancers all over his face that had just not been treated for a while because there was no one there to treat him. And there was no medical care. So we were like in a village 5 hours outside the capital, Antigua. And so we were in this tiny place and with very limited resources. And so I was doing these surgeries, some on the kids, treating burn patients there, some burn patients, treating, but mostly treating these kids that have these cleft lips and palates. And in South America, there's a lot of stigma for these children because they have difficulties with job or education or other things. They're made fun of. And so, basically the first day I did surgery, there's a photo of me where I'm holding these 2 babies that have cleft lips, and their mom, one was from one lady, one was from another, and they're surrounding me. And then I remember handing the mother her child back after I just did the first cleft lip, and her just looking at her baby and seeing her lip repaired and just the tears flowing down her eyes. It was like tears of joy. That's something so incredibly like touching and moving that it's beyond like any object or anything money could buy or anything like that. It's what some people would call psychic income. This just immense feeling of just that you've put so much good into the world and that you were able to do something good. Like, sure, on my vacation time, I would have maybe, been sleeping in or, relaxing or doing whatever. But that was so great that actually I would stay late each day so we could do more cases to help as many people as I could in those 2 weeks that I was there. So I did that for a few weeks. And unfortunately, then when the world shut down, I wasn't able to go back since, but I'm planning on making another trip, maybe to a different location, maybe to the same. We're figuring it out now, but just to go do more pro bono surgery to help out, basically people that are less fortunate and don't have resources.
That's insane.
Thank you. And that's obviously very different than what I do in Calabasas.
Yeah,
which
it's
is,
almost absurd.
It's on, but that's the beauty of plastic surgery. It's on 2 ends of the spectrum.
Yeah.
I could treat kids with cleft lips and palates who have 0 resources, and I just donate my time, or I could come here and do, facelifts or BBLs and buttock augmentation. And that's the beauty, is that I can do the whole range of surgery, and all that time and education and training that I've had in the decades prior have kind of led up to this moment.
So you're saying helping these kids in those 2 weeks almost like makes you more joyful than being like on a 2-week yacht,
basically,
right?
Yeah, totally. Because that you've done something that you can't accomplish otherwise. And
Yeah.
it's not something, it's not something money can buy. It's not something anybody can gift you.
Yeah.
It's your own hard work and education,
And you feel so useful, no?
Yeah, absolutely. Yeah, that's a very good way to put it. To put it into words, it's
Yeah.
like you feel really. It's like a breath of fresh air. You basically, you get away from the world, you get away from practice, and I have access to phones. The power went out in the middle of one of the surgeries, And I had to finish suturing inside this child's mouth with someone holding an iPhone light up in the last like half hour of surgery because the generator went out because a storm hit the area. So, I mean,
So somebody's holding the iPhone.
Somebody's holding an iPhone light in the child's mouth while I'm finishing closing things up, because otherwise he still has this hole in his mouth that I'm trying to put back together.
And the child is out or no?
Child is out. But again, we're on backup, even the backup power is going out. So you need to finish quickly because the anesthesia is not going to last that long.
And you have assistants that speak English, or?
I have, some assistants, some mostly broken English, my broken Spanish, kind of going back and forth. But again, we're kind of able to communicate enough, and they're experienced enough, and I'm experienced enough where we could, safely finish the operation and get through everything. But yeah, I mean, those are versus very different conditions. You come into like a very posh office or operating room here, you have all these things. There's, 1,000 fire extinguishers and safety bells and alarms and generators. Over there, it's like, oh, okay, the power is going out because the storm's coming through. You guys, you better suture a little faster than usual. And so, you just get to it.
Man, so it's not like absurd to you that people are like, they fix themselves up and then they're like, it's not, let's do another one. Like,
no, it's not absurd. It's just different. It's a different
I know, but
setting.
the joy, like how you said, like just to be like to have something that you don't want to live with, right? And you're like helping them.
Yeah, it's a very different experience.
They don't think about bigger tits, or
No, definitely not. It's a really different experience. It's a really different experience, but I really enjoy both. Like I don't think I could do that all day every day for years, and you can't do this all day every day for years.
So, it's like a balance.
As a balance is really important, and I think if you were to come to me 10 years ago, I had very little balance, and so I would just I was working 100 to 120 hours a week at the hospital, crazy hours, barely slept. And then you move to now where, now I run, my 2 practices and continue to expand and grow beyond that. And there's a lot more balance. And so I can pick and choose. I can offer basically patients a lot higher level of care because, again, it's not a 7-Eleven model where people are coming through. I'm giving them their time. I'm giving them everything. And, thankfully, the practice has grown very rapidly. Just because, I do put a lot of attention to detail on the results and patients are happy. So happy patients, always bringing more happy patients is always the best thing.
Did you always knew you didn't want to work in the hospital system, or did that come in time? Or
no, I think that came in time. There's definitely a role in the hospital system and like being a part of a big hospital. And there's some.
But when you say like 120-hour weeks.
Yeah, I think there's a lot of inefficiency in that system. And knowing me, I don't like inefficiency at all. It really bothers me because I don't mind spending time, but I don't really like wasting time. And so there's a lot of inefficiency and wasted time at the hospital. You're just kind of sitting around for hours waiting for the case to start versus in my own practice, I run the show. I can walk in and say, I want this, this, and this. And if there's any hang up, like I have direct influence over it, I'm not waiting for someone to come down or do something or change something. So it's a very different experience. And being able to run more efficiently really was the key draw to me. Being able to run my own practice rather than be an employee, like a cog in a big wheel, was kind of what sealed the deal for me.
Is there anything to fix the American hospital system?
Oh God, you're gonna need a whole another episode of the podcast for that. Maybe you're gonna need a whole season for that. Yeah, there's a lot that can be said about American healthcare, which, or
like, are you a fan of American healthcare?
It's got its ups, it's got its downs, and
it's a tough question, right?
It's a tough question. I'm not a fan that there's people who need care that can't get it. You'll find that in any healthcare system. So, I wish I could say it's different. I would be a bigger fan of eliminating the waste that is in our healthcare system because there's a lot of waste that happens, whether it be supplies, whether it be time, whether it be expenses. And I think one of the big problems with American healthcare is there's a big lack of transparency for the consumer, aka the patient, in terms of where all those expenditures are going. But you hear about people who get these outrageous bills, like over $1 million from like a hospital stay, or they got injured and they woke up and they didn't know they were in the hospital, and then they get these crazy bills. And I really don't think healthcare is something that should be putting people into bankruptcy, but it happens every day.
You think it should be for free?
I don't know if free is the right word, because we think about free like a Mr. Beast giveaway free, and that's not really true. It always comes at some expense, right? Because someone has to buy something for you to be able to get your healthcare. But is it tax dollars that should be better apportioned to it? Is it we should restructure that system? I think there's some inherent things within our healthcare system and how our tax dollars are being spent that could probably be better for the good of the people. But I don't know if we'll ever see that day. But that was another reason, coming back to like, why did I choose to go to private practice? That was one of the big reasons. And on top of that, I, personally, I don't work with any insurance companies. And that was also one of the main things for my practice was that if anyone has insurance they're trying to use, they can use it, but I'm not a part of any of their insurance plans. So if they get some benefit out of it, all the power to them. But especially for cosmetic procedures, there's almost none. But I just found that it's less aggravation and time off of my life spent filling out paperwork and having, a lot of practices have people in their office just dedicated to filling out paperwork, which is crazy if you think about it. Like there's whole things and then back and forths, and I have some of my colleagues in other specialties that I'm friends with. They're like, oh yeah, we have 2 or 3 people in the office that just deal with insurance paperwork, which to me is crazy. But hey, that wasn't for me. That's why I'm in my specialty. They can tolerate it. I guess that's why they're in their specialty. But
not only that, with insurances, then becomes more tricky, the whole thing. I feel like you're like a part of the health system, but then you're not a part of the insurance system, which is really nice because then they don't get to say or tell you anything. And I feel like, especially in the health, like when I used to work at the Red Cross in Austria for 9 months.
You told me that.
Yeah. And I felt a big hierarchy. Like, like I was like at the very low end of the hospital, and the doctors are like on the very high end, and I don't have much say, or like it's a very up down pyramid scheme where like I felt like
you're right. Yeah, you're totally right.
And you have to just follow rules with no questioning. Things cannot be changed. Everything is very old school sometimes, especially in the hospital. I don't know if it's in America the same as in Austria, but everything was very like, you cannot question anything. If it makes sense, if it's wasting time, the patient's time, the operator's time, there's no questions to be asked, and also no changes to be made.
Totally. Yeah.
Changes always come from top and never from the bottom.
Yeah, and that's one of the other things is like, often the people making those decisions are not medical care providers. They're not physicians.
Mm-hmm.
And so then you kind of start to understand why there's a lot of conflict, because as a doctor, our duty is always to provide the best for our patients. I really live by that. I drill that into my staff every day, that, we have to provide the best level of care for our patients, no matter the circumstance. And of course, in aesthetics, it's a little different. But at the end of the day, it's still patient care you still have to provide. And I really live by that, to give patients your everything, because they put their trust in you. They're letting me, alter their body or their face, or they're going under the knife with me. And so in that situation, for sure, it's so important to be able to make sure that they're going through with 110% confidence, knowing they're getting the absolute best care they can. But when you're in a hospital setting, if something's not right and you say, hey, I want to implement some change, here's some feedback, it often goes nowhere. And that's because the provider and the administrators often find some kind of conflict. And if you really chase that down to the nitty gritty, it probably comes down to something financial, which again, in my opinion, isn't right.
Absolutely. It always comes down to the financial, which I think is at least with plastic surgery, it's more, first of all, you're not like in pain making the decision most of the times.
Right.
And you make a more like a rational decision about what you want and what you're going to pay for. And you kind of know, I'm going to do my breast and I'm going to pay for the breasts. Right. Compared to you have a car accident, you wake up, they fix this and that, and they say you need this and that, and they just inject it kind of.
Yeah, no, you're spot on.
Yeah. Which is kind of scary. But also, like, I get why you don't want to be in that system and you don't want to deal with insurance companies.
Yeah,
You
and
know?
it's not so much that I don't want to deal with them. I'll help out my patients in any way I can.
Mm.
Um, if I can help them in some way, I will, even if it's insurance related. But oftentimes it just doesn't work out, and that's more, I think, specialty related rather than me. It's just a lot of what my specialty doesn't really overlap with insurance. Some things, but not a lot.
Has the last 3 years been scary? Well, it doesn't affect you that much, but of course you had to close. There's so much medical stuff, and then I've seen so many doctors lose their license because they say something that doesn't agree with the overall opinion on things.
Yeah, for me and my practice, I left the hospital system a few years ago and I opened my practice. And actually, again, there's no wood in this room, but here I'll knock on wood. There's things have been really great. I was quickly able to expand to 2 locations, and I've just been continuing to build and grow. I just expanded my office even larger than the one you were in that last time, and that happened just in the matter of a few months. And so it's just continuing to grow. But I do know some people that have fallen on hardships. I think in aesthetics, uh, you know, we notice a boom, if anything, because I think, when people were on Zoom, people had more time off. They weren't traveling as much. They had more disposable income. There was aid coming through. And I think a lot of people chose to, some people saved it, some people did whatever with it, some people needed it and they used it. But the ones who had extra decided to, I think there was a change and shift in mentality and behavior, just of the US population in general. But self care kind of became a little more prevalent. And people were like, oh, because people are thinking, hey, you know what? This could be my last day. I should probably go, do something and enjoy a little more. And some of that enjoyment for some people is taking care of themselves or how they look. And so, yeah, I saw a huge boom and haven't seen it go down, thankfully. So we're just continuing to roll. But I do know some practices definitely fell on some hard times.
Have you had any friends, like doctor friends, that lost their like license or anything like that, or no?
No one that I know that lost their license. Me personally, just stay out of controversy, and a lot of a lot of those things don't affect me and didn't really affect me. So no, I never really saw that.
Crazy. And then maybe you can talk about, I love one of the stories you told me, I'll never forget that, was this, like, we don't have to mention her name, but like there's a people, you fix their butt and then they sell like workout
Oh,
videos.
yeah. So this is not uncommon. I work with a lot of influencers, yourself, a variety of others, whether they're big on different avenues like Snapchat, TikTok, Instagram, whatever it is. And yes, there's an influencer that's pretty large in the kind of fitness and workout space that I had done some work on, and done her BBL and buttock augmentation. And I don't think at any point, I don't know because I don't follow too closely. I'm always operating or seeing patients, but at some point was selling, butt workout videos. And I, at that point, at least, was not open about the surgery she had had. So, for me, that's always an interesting thing because, of course, I had made her butt the way it was. But out of respect for her privacy, I can't say anything, nor would I really. But even if I wanted to, so you just have to maintain and respect that patient's privacy. But yeah, that is one person out there. But these things happen. It's not that uncommon. I mean, happens with celebrities, it happens with artists, it happens with influencers, a lot of different things. Perception and reality often don't line up, which is part of why I like to stay pretty low key. I don't have much out there. I don't put out a lot of stuff, me personally. Everyone's on my case that, you have so many more before and afters. Why don't you post them? You have so many more things. And it's true, social media did change the way people evaluate aesthetics and healthcare. But I also always maintain that you really want to put out high quality content, and you always want to also make sure you're respectful of the people that you're blessed to take care of them. And I have a lot of people that come to me that say, I actually love the fact that you don't have too much out there because there's a lot of noise in aesthetics. Like if you look at some people's page, there's a ton of people. You're like, oh, Dr. So-and-so is this or that. But, there's a lot of kind of fake stuff out there on the internet and a lot of fake stuff in aesthetics, whether it be followers or likes or whatever it is. And I'm sure you guys know that too. It's no different from influencers you may know or people in TikTok or whatnot. But it is what it is. But I stand true by the fact that if you do good work and you keep going, then your work speaks for itself. You really don't need anything other than that. There's no amount of likes or other things that would change the quality of your work, and so people will always see that, and they'll see your results and your quality, and that'll always keep people coming back.
Do you think there's a connection between plastic surgery and social media?
Oh, huge connection. Huge connection. So much so that, recently I've been seeing that Instagram is starting to censor a lot of plastic surgeons and their work. And I, for the first time, actually got recently a notification on my Instagram that said, I got like some pop-up that says something like some of your content doesn't follow our guidelines. Most of my content is pretty benign, very careful with before and afters. You have to keep the nipples covered and make sure people's private parts are covered. And to a great degree, you post a BBL, you want to make sure everything on the backside is, a lot of it's covered. And so it makes it very hard in a way to show before and afters and as part of your content. But some of my more benign content somehow had been flagged, and you just address it as it comes up. But yeah, no, there's a very large crossover between social media and plastic surgery and aesthetics. Some of it's positive, some of it's negative, but there's a lot.
What about sex changes?
What about them?
Do you do them?
I used to. Yeah, I used.
You've done them?
Oh yeah, I did a lot of them actually. Both for
female to male, male to female.
Mm-hmm. Yeah, I did a fair bit of transgender surgery, and I still offer it for patients that come in requesting.
Is that booming, or is that just an internet thing?
Hard to say. In the Bay Area, I used to do a lot of it, quite a bit. It's also a lot in LA, but I think it just depends. Some centers kind of have a large amount of patients, and so that's what they focus on. In my practice, I do some of the top surgeries. So that's for female to male transitions that would involve a mastectomy, removing breast tissue to give a more masculine appearance to the chest. Again, I have done some bottom surgeries by request, but a decent amount also of what comes in is facial feminization surgery, so male to female facial transitions and ways to soften the facial aesthetics to get rid of some of the masculine features to align more with the person's female. But it's certainly by no means a focus of my practice. But I do have some patients that come in and request it, and so that's something.
How old do you have to be to do that?
There's a very clear set of guidelines. Interestingly enough, so I personally don't operate on anyone under the age of 18. But I do know other doctors that offer surgeries for patients who are under the age of 18, mostly for the chest surgeries. And so I think I've heard at least as low as like 14, 15 years old.
Legally?
Yeah. Yep. But in my practice, I don't.
Yeah. What about, do you do the hormones then too, or is that from a different doctor?
No, that's usually their endocrinologists or their hormone doctors are kind of handling a lot of that stuff. I just, you just have to coordinate their care to make sure they're all good and optimized and everything. But there's a whole set of guidelines that it's called like WPATH guidelines that you follow. And those are kind of like the gold standard recommendations. So as long as everyone kind of checks those boxes, they're kind of okay to go as far as surgery goes.
Is the sex change really one of the toughest surgeries, or?
Yeah, I mean, we call it gender reassignment surgery.
Mm-hmm.
There's a variety of different names. Is it tough surgery? I don't know. I've done a lot of crazy reconstructive surgery, so I wouldn't say it's necessarily tough. But there's a lot involved in the surgery, and obviously it's a huge transformation. So we don't. No, I don't find the surgeries themselves terribly technically challenging, like from a surgical standpoint,
Hmm.
anatomy and those things. But there's just a lot involved in getting the patients to the surgery and getting them through recovery. So it is definitely very time intensive surgery.
Yeah, it sounds crazy because like getting bigger butt or bigger tits is different than changing if you're a man or a woman, kind of,
Yeah,
right?
yeah, it's a different
Because you have
flavor.
like a man come in the office who leaves as a woman.
Yeah, and yeah, I'll, I'll leave it at that.
That's crazy because you're not a therapist. You're
No, but
like,
no, but they have other providers that help take care for them. They have,
yeah,
there's either a psychiatrist or psychologist. There's an endocrinologist managing hormones. They have a primary care doctor. There's a lot of people involved in the care,
yeah.
and it's never on the shoulders of one person. Um,
Do you talk openly about prices?
Prices,
Mm-hmm.
like for cosmetic surgery.
Mm-hmm.
Yeah, I mean, at some point somebody's got to know what they're paying for surgery. It's not like they show up. It's
Yeah, maybe you
it's a
can give a
surprise.
price range for like, because I guess it's kind of interesting if you never, well, me and Baby J, we visited you.
Yeah.
It's different, but like, let's say like somebody has never visited a plastic surgeon. Like, what do you pay for like a BBL compared to like lips or bigger boobs?
So so the hard thing is that a lot of people will call and they'll ask for prices over the phone.
Mm.
I hear it all the time from my office staff or whatnot. And it's hard because obviously you don't want to waste anyone's time, neither mine or the patient's time. Um, but it's also hard because it's really hard it's not like a handbag where you could just call and you're like, well, let me look it up in the catalog and, oh, this is this price. So a lot of people will call in and request like liposuction or how much is a BBL. And it's really hard because that depends on what's your height, what's your weight, how much fat do you have, what's your end goal, how many areas are we treating? Is it just your upper and lower abdomen? Do you want your waist done? Do you want your shoulder, your back? Do you want your thighs, your arms? Um, and so, it's really hard. So I just have them say, like, for example, in my practice, I actually do a lot of awake liposuction. A lot of people don't know, actually, I do a lot of awake fat transfers. So a lot of BBLs can be done awake. A lot of breast augmentation with fat instead of an implant can be done awake. And so, that's that in my practice, I just say that starts at $5,000 because I don't know. Are we treating just a little bit of the chin and some double chin fat? Are we treating like a whole stomach? Is it someone that's so large because there's only so much you can remove in one day that you say you're going to have to come back and we're going to break this up into 2 surgeries? So obviously that's all part of it. But yeah, in general, we just say it starts at $5,000, and then if you want, you can send in photos, or you can have a consultation with the doctor either in person or via video, and kind of go from there.
5,000 for
Starting at liposuction, for example.
liposuction.
Yeah, that's like the starting introductory price.
Yeah. What about BBL?
Well, a BBL is liposuction with fat transfer. So
Mhm.
it would kind of be the same thing. It would be starting at $5,000 because we don't know how much we're doing, what we're
Yeah.
doing, and all those things.
What about nose?
Again, it's hard. Is it a primary rhinoplasty? Is it a revision? Is it, have you broken your nose before?
Maybe starting at
Septoplasty. Are we just shaving down a bump? Are we just doing the tip? Probably the lowest starting price on a nose is, I don't know, probably like $10,000.
and going up to
25 to 30.
Yeah.
Yeah. At least, in my practice currently. I'd say probably about 30,000. Just kind of wouldn't go past that for
and
most
the
people.
BBL starts at 5 and goes up also probably to
It depends how many areas.
Right.
That's the hard thing. How big is the person? Because you're also capped at how many liters of fat you can remove. So if you think about like a 2 liter of Coke, like that you would buy in a grocery store as an example that people can relate to, you can only remove a few of those in one day as like the max.
Mhm.
And then after that, you have to start staging and doing.
So there's a possibility of having two.
There's a possibility of having 2 surgeries.
Yeah.
If someone's large enough, you say, okay, well, they only want their butt this big, for example, but the rest of the fat we're just going to we're going to get rid of, or maybe they want to put it into their breast. So they'll come in and they'll do half the surgery on one day. We'll do the buttock augmentation. We'll do the BBL, and then we'll do the other half of the surgery, and they'll say, okay, we'll do the fat transfer to the breast. And the other, here's the other challenging thing is like for some patients after skin tightening, called J plasma or Renuvion. And, again, that's something that can be done awake. So a lot of people are moving away from doing surgery under general anesthesia if they can. They want to do it awake or under light sedation, which is fine because it's a faster recovery and it saves them on costs because you're not having to pay for anesthesia, the fees, or everything's just lower. And ultimately, that's for the benefit of the patient because every time you come in and you ever think about surgery, there's always three components minimum to your surgery. There's the procedure fee, there's the OR fee, and there's an anesthesia fee. And if you're doing something that requires an implant, like a breast implant or a chin implant, then that adds, an implant fee. And so when you break it down that way, well, obviously, healthcare being expensive, people are trying to reduce on the other fees outside the surgical fees. And that ultimately just kind of benefits the patients. It's a quicker recovery and they're not having to spend as much. So it's a kind of a win-win.
Do you do stem cells?
I do. Stem cells is kind of like a catch-all term, but I do offer stem cell treatments and therapies. A lot of it centers around PRP, platelet-rich plasma, which is kind of like you've probably seen online. They take your own blood, they spin it down, we get your stem cells out of your blood, and we use that for rejuvenation, usually in the face. Some of my colleagues in orthopedics use it for like knees or shoulders and
I've heard
joints.
people love that or like great results with like knees and
yeah, I don't do it for joints because it's outside my specialty. I'm not an orthopedic surgeon, or an orthopedic doctor, but for aesthetics, it definitely is really effective. And it's really nice. Like if I was going through something personally, I would say, to do PRP or PRF, which is a variety of PRP, platelet-rich fibrin instead of platelet-rich plasma, to basically be able to use your own blood to rejuvenate things, not have to put something foreign or use anything other than that. Because again, people are more and more hesitant to undergo any of those things, including members of my family. They're like, I don't want filler because I don't know how my body's going to react to it or whatever it is. And I say, that's fine. To have something from your own blood used on you that's going to give you a benefit in how your skin looks or how your face looks and those things like that. I mean, that's a huge win-win. In my practice, mostly what I'm doing it is PRP with microneedling. So I'm doing it for facial rejuvenation, facial aesthetics, just kind of improve your skin tone and quality. We'll do it kind of like on the face, cheeks, chin, neck for someone who's a little bit older, or the upper chest area for women where it shows in their dresses and gowns. Some people will do it for their hands, which is also good.
Yeah, do you do any practices on your own body?
I don't.
That's number one question, right?
Yeah, no, I get that question actually not uncommonly. I have personally never had anything done.
Are you planning on?
No plans. We'll see how Father Time treats me. But as of right now, no, I don't use any. I don't use any Botox. I don't use any fillers. Haven't done any microneedling PRP. Some people ask like, oh, why? And again, people should do these things if they want to or if they feel like they need it. Me personally, I don't want to take away from the time I'm spending and what I'm kind of going through right now. But if I had a week or two off, would I do a little PRP or microneedling? Probably, sure. But also, it's one of those things where I'm a big perfectionist and it's hard to find somebody I would trust to actually do it on me. So that's the other thing. Like, and I wouldn't do it on myself. So
yeah, if you know all the steps.
Yeah,
it's something else. What do you think about like testosterone for guys? Like,
there is a lot, especially here in LA. There's a lot of men's health clinics that have popped up. And some people may know or may not know, I actually do a fair bit of male surgery.
I saw that on your IG. I'm very surprised because you always think about big butts, and then you have those guys with the ab. You do the ab stuff.
So I have done actually quite a bit of male liposculpting. So that's kind of like removing fat from their abdomen. What I call the modern man procedure from modern plastic surgery in my practice is the modern man. It's basically like a very non-invasive or minimally invasive, I should say, way to remove fat, shape out the abs, give someone kind of like more definition in their abs, their chest, remove the male breast tissue known as gynecomastia or gyno, commonly in guys in the gym. And sometimes we'll do fat transfer procedures to the shoulder heads to make them bigger, give them more of that coconut shoulder head, or, just again, kind of create more definition. And people think like, oh, does that look weird? Or, if I touch their six pack, is it like pudgy? No, it's not, because it's based on their anatomy. I'm not making muscles that don't exist there. Everyone has those muscles. They just may not have that definition. And so it's actually pretty gratifying. And again, that surgery typically used to be done under general anesthesia and would take a really long time. And I've kind of perfected it to where I can do it under a few hours. You don't have to undergo general anesthesia. You can do it awake or under sedation. You're just kind of chill and relaxed. Most people just kind of take a nap through it or snooze through it. And that's pretty much all we're doing. I just did one the other day in my office. And typical age range for that is guys anywhere from about 18 to even their 50s are having it done. And it really holds up over time. It's not like it just like goes away. I have patients with results years out that are coming back and they still look good or even better with time, because again, it's one of those things where they feel motivated now. Like, oh, no matter how many times I would go to the gym, I just could not see my abs as defined as I wanted to, or I always had this little stubborn area of belly fat, and you get rid of that for them. Nothing wrong with that, and people just feel better.
That's crazy. And maybe better than taking crazy hormones.
Yeah, I mean, definitely, I don't advocate for anyone to use or misuse any of those things, because, there are health risks associated with it. I don't do any hormone therapy in my office. I don't do any of those things. I always refer people to the doctors who are specialists in those areas, and I hope that, they're treating patients within the limits of normal. But I stay completely out of the kind of the hormone supplements, all those things. I have zero to do with it, because it's out of my specialty, and it's very involved in like testing and labs and all those things. And at heart, I'm a plastic surgeon. I like to do procedures and all those things. And so, being able to do a lot of male sculpting, the most common procedures for males are kind of the high def liposculpting that I'm talking about, the modern man procedure, including the fat transfers to the shoulders or the upper back muscles to give them a wider lat look, more defined arms. Sometimes I'll do high def liposculpting on the arms to make the deltoids stick out a little more, give them a nice little tricep stripe. And then probably the next would be the gyno, the male chest surgery, which kind of goes hand in hand with that same procedure. It can be done at the same time, and a lot of guys do opt to do it at the same time. And then probably the next would be kind of tied between, for the older guys, like getting facelifts done or neck lifts, because guys tend to get more of a sagging neck earlier, versus doing male noses in a little bit of a younger male crowd, like 20s, 30s. That's kind of the mix of the male plastic surgery I do in my office.
That's crazy. So whatever you need, you get it done.
Pretty much, it's always interesting, because when people come in and they ask about a little bit and they're like, oh, you can do this. Oh, you can do this. Oh, wow, I could do that too. And a lot of people don't know, which is, again, the value of the consultation, to sit down with the plastic surgeon and speak to them, versus just like stuff you've read online. Because there are a lot of people in my field that don't offer a wide range of surgery. They just kind of focus on one or two procedures. And there's different schools of thought, like, is that better or is that worse? I don't think it's either. I think if you care about what you do, you're going to do a great job regardless. Some people say, oh, I only want to go to a breast guy. So, okay. I mean, I've revised plenty of surgery from people that have had surgery with the only breast guy. So, it's not so much one or the other, like, oh, I only want to have surgery with someone that's like a lipo expert. In our field, one of the challenges is a lot of people claim to be experts. There's another challenge in cosmetic surgery we haven't really talked about, which is, in the state of California, at least, there are people who are not plastic surgeons doing cosmetic surgery. And I think we might have talked about this very briefly when we first met. So I personally am a board certified plastic surgeon. That means I've achieved the highest level of certification that you can in my field and profession. That being said, I'm also a Stanford plastic surgery graduate. There's a very select group of people that graduate from Stanford Hospital. But in California, you have people who are not plastic surgeons at all. Not only are they not board certified plastic surgeons, they're not plastic surgeons at all. They're like an OBGYN that used to deliver babies that's doing liposuction. You have internal medicine doctors that are doing liposuction or doing cosmetic procedures like breast augmentations. You have some people who are general surgeons that would treat hernias and other things, and they're doing these procedures because, there's money in it in aesthetics. But the problem is that, they are not really trained or qualified to be doing these procedures. That being said, the state of California allows for it. And a lot of them, what they'll do is they'll advertise themselves as a cosmetic surgeon. One thing you'll never see on my page or anywhere about me is that I'll refer to myself as a cosmetic surgeon, because I'm not. I'm a plastic surgeon. And that cosmetic surgery is a part of what I do. But when you see people advertising themselves as a cosmetic surgeon, that usually means they're not actually qualified, and because it's not legal for them to call themselves a plastic surgeon. Unfortunately, they're preying on the public who doesn't know the difference or knows any better. And they're like, oh, and we get this every week in our office. Every week. I went to this doctor. He's a cosmetic surgeon. He does plastic surgery, and he did my mommy makeover, and it's botched. And you say, you know what? Let's just take a look into that doctor. Can you, what's the name? You just pop it in. You go to the American Board of Plastic Surgery. It takes 2 seconds. There's a public search. You just type in, person doesn't show up. Go on Google, look it up. They're like, oh, I am a cosmetic surgeon. Okay, you look at their qualification. They're like a family medicine doctor that used to treat colds or, rashes or hemorrhoids or whatever, but they have no ability or training in cosmetic surgery outside of maybe they went for a month and watch somebody else do surgery, and they got like a certificate. They pay like $5,000 for a weekend course just to learn how to do surgery, and not even on real people. They practice on like a cadaver or a body or a fake plastic body or something like that. And they kind of learn a little bit, and they're like, okay, I'm going to go try it out on real people. It's really sad though, because you see that, there's like someone who's an oral surgeon. He's like, is a dental doctor, basically, does surgery on the mouth and the jaw, who was, putting in breast implants in his dental office, which is crazy. And how many people that I've gotten in my office revising that work is nuts. I mean, it's really crazy. I can't talk too much about the details because it's their privacy, but that's insane, and it's really unfair to the public. So, what I would say is, definitely look up your provider, make sure that they are a board certified plastic surgeon before you go to them. And make sure that they're qualified. It's super, super important. It's your body, it's your well-being. A lot of people are lured in by the term cosmetic surgeon, or the pricing of those people is usually a little lower because, of course, compared to whatever their profession normally does, it would be better for them to slash their prices down and try and do decent, pseudo messed up cosmetic surgery than to do something else. And so that's really crazy, but that's a huge problem, and you see a ton of it in LA because it's a large population.
That's crazy.
Yeah,
I thought it was always like out of the country.
You would think like in California, which is such a progressive state, and we highly educated population and all those things, but it's happened so rampantly here where people are referring to themselves as cosmetic surgeons, but they're in fact not. They're not qualified. But it's not illegal what they're doing. It's very misleading. It's very unethical, but it's not illegal. So they keep doing it.
Yeah.
So that's one thing. If there's anything I would change, is at least that would change in the state of California, because it breaks my heart every time I see people that come into my office and they say, I went to Dr. So-and-so, I spent a fortune, and he just totally thrashed my body. And sometimes some of those problems that they have are really not repairable. They're not fixable. So it's really important to go to a qualified provider, someone who knows what they're doing. And, again, being a board certified plastic surgeon, I can say with full confidence, the amount of things you have to go to and go through to be able to say you're board certified as a plastic surgeon is immense. The amount of time, energy, education that I had to go through, and others that kind of share my qualification had to go through is insane. So do your homework.
Do your homework, and check out Modern Plastic Surgery. We're gonna link you down below.
Thank you.
Your IG, your homepage, YouTube, so they can see exactly what you do.
Thank you.
And the results, the patients, everything. There is some on your IG that I like a lot.
Yeah, thank you. I
Yeah.
appreciate it.
Even though you have a lot more, but you can get a kind of a picture, and if they want, they can just call you up, get a consultation.
Totally. They can call me 818-823-0655. 818-823-0655. That's my main practice line. And there's a lot of before and afters that we don't have permission to post online, but we have permission to share in the office, which happy to go over more if anybody ever wants. But yeah, check out my Instagram at Dr. Shawn Moshrefi, and my TikTok at Modern Plastic Surgery. And always a pleasure to see anybody in person or virtually online in my Calabasas or Beverly Hills office.
Amazing. Thank you so much.
Thank you, Candy. I appreciate you, man. It's always a pleasure getting together with you. Always a blast.
Of course.
This guy looks amazing. And on the record, I didn't make his body. He just looks amazing as is. He earned every bit of that. But yeah, it's always a pleasure and congrats on the second baby on the way.
Thank you.
Of course.
Thank you so much.